I am Eddie Rodriguez, pharmacist, biochemist, diabetes educator, and I want to talk about a serious topic: deep vein thrombosis. Many people ignore the early signs and waste precious time. Today, I will show you 5 signs that require immediate attention. I will also explain who is at higher risk, what to do to prevent it, and when to seek help without delay. Stay with me until the end. Comment where you are watching from, and tell me if you have ever experienced any of these symptoms. First point: what is deep vein thrombosis? It is the formation of a clot inside a vein, usually in the leg. It can happen in the calf, the knee, the thigh. This clot blocks blood flow. The blood becomes trapped. The vein inflames. The leg changes in appearance and sensation. And the biggest risk is the clot breaking loose, traveling through the body, and stopping in the lung. This is called pulmonary embolism. It is an emergency. That's why early recognition saves lives. Now let's move on to sign 1. Pain and tenderness in the leg. A pain can appear suddenly, or it starts mild and worsens over the days. It can be a pressure, a tightness, a heaviness, a burning sensation, a throbbing that doesn't go away. Many people describe it as if the leg is hurt inside. Light touch already bothers. Walking worsens it. Staying still for a long time also makes it worse. Be alert when the pain is only in one leg, without a clear cause. No fall, no blow. This raises the alarm. Sign 2. Swelling on one side. Swelling usually appears in the leg with the clot. It becomes more noticeable in the calf, the ankle, the top of the foot. Compare one leg with the other. Place both feet side by side. Observe the difference. Sometimes you can see the sock mark. Sometimes the shoe feels tight on only one side. If you have a tape measure, measure the circumference of the calf. A difference of more than 2 to 3 centimeters is concerning. Pain plus swelling is already a reason for quick assessment. Sign 3. Redness and warmth. The skin can become reddened or darker. The surface feels warm to the touch. This happens because there is inflammation around the vein. Not all redness is thrombosis. Insect bites also cause the skin to turn red, but the combination of heat, redness, swelling, and localized pain in one leg, without an obvious explanation, strongly reinforces the suspicion. Sign 4. Calf hardening. The muscles seem stiffer, less pliable. When pressed with fingers, the calf feels swollen. Moving the foot causes pain. Stretching the tip of the foot increases discomfort. Going up and down stairs becomes difficult. This hardening is common when there is a clot inside the vein of the calf. Sign 5. Sudden shortness of breath and chest pain. This is the most serious. It may indicate that the clot has moved, and it went to the lung. The person suddenly feels short of breath. Shortness of breath. Chest pain that worsens when taking a deep breath. Palpitations. Dizziness. Coughing up blood. In this scenario, the guidance is clear. Seek emergency care without delay. Now let's talk about risk factors. Smokers are at higher risk. Those who are overweight too. Advanced age increases the risk. Recent surgeries, especially major surgeries. Prolonged hospitalization. Cancer and treatment. Use of hormones such as contraceptives or hormone replacement. Pregnancy and postpartum. Long-seated travels. Several factors can add up and further increase the risk. Immobility is an important trigger. Staying still for many hours without moving your legs reduces blood flow. The blood becomes stagnant. The risk of blood clots increases. This applies to airplanes, buses, cars, and even for those who work sitting for many hours. If you are going to travel, stand up every 2 hours. Walk a little. Flex your feet. Make circles with your ankles. Drink water. Avoid excessive alcohol. Wear compression stockings if your doctor has already recommended it. Let's talk about prevention in daily life. Move your legs several times a day. Short walks already help. Strengthen your calves. Standing on tiptoe activates the muscle pump. Control your weight. Leave cigarettes behind. Drink water throughout the day. Avoid spending many hours without getting up. If you work sitting down, schedule breaks. 5 minutes of movement every hour already makes a difference. Those who have had thrombosis need extra caution. Siga las indicaciones de su médico. Use la medicación como fue prescrita. No se detenga por su cuenta. Use medias elásticas si está indicado. Ajuste sus hábitos. Y esté atento a signos de repetición. Dolor. Hinchazón. Enrojecimiento. Calor. Endurecimiento. Busque una evaluación temprana. Ahora un punto delicado. Confundir trombosis con calambres. El calambre suele ser breve. Mejora con estiramiento. La hidratación ayuda. La trombosis no es así. El dolor persiste. A menudo empeora. Y viene acompañado de hinchazón y calor. Si quedó en duda, evalúe. Es mejor pecar por exceso de precaución. Como se realiza el diagnóstico, el profesional evalúa la historia clínica. Examina las piernas. Y puede solicitar análisis de sangre y estudios de imagen. El examen más utilizado es la ecografía Doppler de las venas de las piernas. Es un examen no invasivo, rápido, y suele confirmar o descartar la sospecha. Cuanto más temprano sea el diagnóstico, antes comienza el tratamiento. The goal is to prevent the growth of the clot, to prevent it from migrating, and to reduce the risk of new episodes. Therefore, do not use medication on your own. Do not massage the sore leg. Massage can dislodge the clot. Do not apply heat locally without guidance. Do not wait for the pain to pass on its own. Delay can be costly. Let's review the 5 initial signs: pain in the affected leg, swelling on one side, redness and warmth, hardening of the calf, shortness of breath and chest pain when the clot migrates. With 2 of these signs, it's already worth seeking evaluation. With shortness of breath and chest pain, seek urgent care. Quick tips for those traveling: book seats with legroom when possible. Bring a water bottle. Avoid long naps without moving your feet. Do simple exercises while seated. Stretch and flex your ankles. Squeeze and release the calf muscles. Get up in the aisle every 2 hours. Compression stockings may be helpful for those already at risk. Talk to your doctor beforehand. And for those recovering from surgery, ask when you can walk. Follow the early mobilization plan. Use the stockings if recommended. Use the injections to thin the blood if prescribed by your doctor. Do not stop on your own. Stay hydrated. Observe your legs daily. Now I want to talk to those living with diabetes and high blood pressure. Control makes a difference. Sugar outside the target and uncontrolled blood pressure harm the vessels. Improve your diet. Maintain a routine of movement. And follow your healthcare team's plan to reduce the risk of thrombosis and embolism. If you've made it this far, share this information with those at risk. Bedridden people, people who travel a lot, pregnant women, elderly, those using hormones, those who have had thrombosis before. Such information can prevent a bigger scare. I want to hear your comments. Have you ever experienced unexplained calf pain? Have you noticed one leg more swollen than the other? Suddenly had shortness of breath? Share your story. Your experience could help someone else seek help at the right time. I am Eddie Rodriguez. My focus is on easy-to-understand health education, not a substitute for consultation. If this video helped you, like it, comment, share in family groups, and subscribe to the EDU Health Tips channel. Here, you learn. Take care. And multiply care. Take care of your legs. They support your life. Recognize the signs. Act early. And live more safely. Today, you already know what to watch for. Now share. And see you in the next video.